I'm Solomon Wilcox at Toronto Memory Program, where a former astronaut, loved ones of a Canadian superstar, and a well-known hockey referee express hope about studies to prevent and treat Alzheimer's disease. They've come from different backgrounds across Canada to call for better treatments for Alzheimer's disease with a visit to Toronto Memory Program.
I think all of us must know somebody, either a friend or a relative, who has had Alzheimer's disease.
It's one of the most devastating things I've had to deal with in my lifetime because it affects so many more people than just the person who gets sick with the disease.
It's a scary diagnosis. No one knows what it's going to look like.
We can't afford to have this huge surge of people with dementia without something to help them.
There's a huge need for better treatments.
I have no doubt that eventually we'll find better treatments to either stop the disease, slow the disease, or prevent the disease.
We need everybody to take this disease seriously, and we will get there.
Words of encouragement from Toronto Memory Program's medical director, Dr. Sharon Cohen, and her husband, research investigator, Dr. Ian Cohen, as some special guests paid a visit to share their experiences and insight about the disease. The doctors welcomed Dr. Roberta Bondar, the first neurologist and first Canadian woman astronaut. Kathy Barrick, the chief executive officer of the Alzheimer's Society of Ontario. Steve McNeil, hockey referee and well-known Alzheimer's fundraiser. Jill Dahm, playwright and actress. And Hattie Dowman, a Vancouver nurse. They are the wife and daughter of John Mann, lead singer of Spirit of the West, who has Alzheimer's disease.
John Mann on lead vocals.
He had Alzheimer's for a year before we made the announcement. John constantly felt like, well, why can't I talk about this? This is not a shameful thing. Like, it's not, I should be able to speak about it.
When John Mann and his family went public with his diagnosis at age 51, it made headlines.
People were like, well, if you got Alzheimer's, you got to come and play now. People jumped on board and were supportive and wonderful in a way that we had no idea was going to happen.
Jill wrote a play about Alzheimer's caregivers called Forget About Tomorrow, with input from John.
He wrote a couple of songs for me. It helped give us a sense of purpose and some meaning in what we were navigating.
Navigating John's cognitive decline has taken a toll on Jill and Hattie, emotionally, physically, and financially.
He had a very well-rounded life, and look what what happened to him.
Alzheimer's can wear anybody down. It's almost impossible to do alone.
It's like a slow extraction of the person you love. And it's a really weird process to lose someone who's still alive and lose them a little bit more every day and still have them physically with you.
Alzheimer's disease slowly took away Steve McNeil's mother and his mother-in-law.
It's one of the most devastating things I've had to deal with in my lifetime because it affects so many more people than just the person who gets sick with the disease. My wife gave up her career to bring in my mother-in-law to live with us with dementia. My wife stayed home for 5 years, took care of her mother 24/7.
Steve delivers the mail every day, and during hockey season, he's a referee. Each January, in the freezing cold, he skates at Toronto's Nathan Phillips Square for 19 hours and 26 minutes to raise money for the Alzheimer's Society of Toronto and honor his mother.
My mother was born in 1926, and she battled Alzheimer's for the better part of 20 years. The 1926 thing is, it's my way of depicting a day in the life of a caregiver, because a caregiver dealing with a parent that has this disease, it's an average day for them is about 19 and a half hours.
So each year, with heavy metal music playing to motivate him, Steve is on the rink outside Toronto City Hall for 19 hours and 26 minutes.
The support I've got each year gets bigger and bigger.
Dr. Roberta Bondar, Canada's first woman astronaut and the world's first neurologist in space started her research into Alzheimer's disease in 1974.
Well, there are lots of unsolved mysteries in the brain for sure, and a lot in space still.
During her visit to Toronto Memory Program, Dr. Bonder looked at the past, present, and future of Alzheimer's disease research.
When I was a resident a long time ago, the brain was considered to be in a black box, and we really couldn't access it unless you had neurosurgery or unless you were in the autopsy room. We have imaging now. We have ways of specifically looking for different components in the brain. We have much better analyses of cerebrospinal fluid. We have better ways genetically of looking at a younger age group that get Alzheimer's disease.
25,000 Canadians are diagnosed with Alzheimer's disease every year. For aging baby boomers, the risks are very real.
We want to know the cause, we know the effect, and we want to have a cure.
The search for better treatments and ultimately a cure for Alzheimer's disease is the mission at Toronto Memory Program, as the staff care for patients and engage in clinical trials with promising drug candidates.
A clinical trial is a research study where we're studying whether a treatment is going to help people.
They're extremely important because we can't move medicine forward without it.
We are first and foremost the go-to place for clinical trials in Alzheimer's disease. And we have a reputation around the world.
We need a treatment for this disease desperately.
Kathy Barrick, the Chief Executive Officer of Alzheimer's Society of Ontario, took the first step towards possible participation in an Alzheimer's prevention clinical trial.
I think the prevention research is probably, from my standpoint, the most exciting.
Kathy's memory was tested and a cheek swab sample was taken to determine if she carries a certain gene that could indicate a higher risk for Alzheimer's.
I actually personally hoped that I would actually be able to participate in some prevention studies. So that's why I did it, so that can I be part of the solution here? Can I be part of finding the cure?
Hattie Dowman, daughter of legendary Spirit of the West lead singer John Mann, was also screened for a potential Alzheimer's prevention study.
I was getting testing done earlier to kind of figure that out, if I have some of those risk factors or the gene. I'm talking to Dr. Cohen and what's going on here, and I'm really hopeful.
Hattie and her mother, Jill Dom, have been pushing for Alzheimer's research ever since John's diagnosis a few years ago.
Well, there's a huge need for better treatments. There's a huge need for accessible trials.
Volunteering for a trial is a way to help researchers.
Finding a sense of purpose and a sense of meaning when you're going through a difficult time can really help you. So if you can feel that you're of service in any kind of way, it will help you get through a difficult time.
It's actually to your benefit to participate in a clinical trial.
It's really the only thing we can do is work towards a cure, and being a part of that is extremely important.
It's empowering for people to feel they can be part of the solution.
Canada's first woman astronaut, Dr. Roberta Bondar, says being a part of the solution, enrolling in clinical trials, has something in common with her work in space.
I look at it almost akin to when I flew in space. It was being a pioneer, and it was almost like a clinical trial. I was willing to do this because I wanted to be able to benefit humankind. And that's what clinical trials are about.
Steve McNeil, a hockey referee and enthusiastic fundraiser for the Alzheimer's Society of Toronto, has genuine concern for his future. His mother battled Alzheimer's for 20 years.
It does frighten me. I'm 57 years old. I mean, I forget things sometimes. You start wondering whether it is something, you hear about hereditary diseases and stuff. My mother battled it for a long time. Sign me up. Seriously, I'm such a strong believer in being proactive rather than being reactive.
The quality of clinical trial work at Toronto Memory Program is recognized worldwide, but the center offers so much more than that.
I think that we're different from most memory clinics because we're a very high-powered specialty clinic that's not within an academic setting. but this is independent in the community, accessible to all.
Toronto Memory Program consists of two areas. One is a community-based OHIP-funded memory clinic, and the other is Canada's largest Alzheimer's disease clinical trial center.
I see myself as privileged to be on the cutting edge of neurology, of behavioral neurology, and also caring for people that I love dearly.
And that expert care comes from respect, dignity, and warmth.
Sharon's very inspiring. She has the ability to carry an enormous workload with a lot of patience and understanding for the people that she works with.
I haven't cured anybody of Alzheimer's disease yet, but I've provided a lot of people with good information, with hope, with care, and I'm amazed at how important that is.
It's important work through clinical trials, individualized care, expertise, and diligence that motivates everyone at Toronto Memory Program.
The Toronto Memory Program, the thing I love about it is it's actually all-encompassing. So it's clinical trials, absolutely, but they're a memory clinic. There are doctors who provide treatment. They provide family support. It's an all-encompassing model to help people through the disease. So really, you couldn't ask for more.
They're the true champions. These are the people that are finding the cures for diseases and stuff, are our researchers. We need to give them all the tools that they need because they are the heroes in this fight.
Oh my gosh, I'm so hopeful after coming here and seeing what's going on and the research that's happening.
They're getting in there, rolling up their shirt sleeves, and trying to find an answer.
Every time we learn something new, we potentially learn a new pathway or a new target to apply treatment. So that helps us get to where we're heading, which is to find a cure.
It's absolutely imperative that we find better treatments.
These special guests, from a pioneering astronaut to a hockey referee to family members of a rock star, share some common ground with the doctors and staff at the Toronto Memory Program. It's the compassionate, personalized care, the expert team, the robust pipeline of clinical trials, and the hope for new treatment and prevention that sets Toronto Memory Program apart. I'm Solomon Wilcox.